Jan, thank you so much for taking the time with me today to catch me up on what you're working on with Canopie.
Well, thank you so much for having me. I'm super excited to share what we're working on and the problem, the big opportunity in the space.
So you're really upgrading the way that women get care when they're struggling with mental health challenges as moms. Kind of break that down for me.
Well, it's interesting because, maternity care is all focused on education and prevention, but the most likely thing that's going to happen to you as a new mom is you're going to struggle with depression and anxiety, but we do nothing about that in our maternity care, which makes no sense at all. So what we're really doing is intervening early in the process and getting effective, scalable support to moms in a universal way by working through existing work streams, existing maternity care pathways, and doing that at scale.
My understanding is that you've been working in advocacy. You haven't always been in health tech, and this is a new business for you. So kind of what brought you into this mission?
Yeah, so I've worked in maternal and child health for most of my career, actually in East Africa, so working with moms and babies on nutrition. But what really brought my attention to the issue was my own struggle. I had my son a few years ago, and it was both the most wonderful time in the world and also the most terrible time in the world for me. And I was screened by my OB and my pediatrician, and realized that I wasn't being connected to resources. There were no resources for me, and we kind of dug into the issue more with researchers, interviewed a lot of moms, a lot of practitioners, and realized there's just a huge resource gap and a huge gap in knowledge of what to do with a mom when she's struggling. But where we really see the opportunity is not just the care and treatment. We have a solution that is effective treatment, but you can actually deliver the same technology early and prevent the health outcomes that are related to untreated maternal mental health conditions like preterm birth, C-sections, preeclampsia, you name it. Your mental health and your physical health are inextricably linked. So we're trying to head off those costs and those outcomes early.
So walk me through the actual patient experience. How do you actually head these things off? We're talking about an early appointment with your OB, being introduced to this kind of product. Walk me through the process.
Yeah, so our goal, because maternal mental health conditions are so common, our goal is to introduce the resource really early at the time of screening and kind of unrelated to the actual screening score, because so many people are actually missed in that process. So a mom will download the app, she'll be screened for depression and anxiety, but we also at that time customize a program for her. So based on whether she might have risk factors for anxiety or have symptoms of anxiety or depression or high stress, we also ask questions about her relationships, her sleep, what concerns she has. Is she struggling with worried about her baby's development or bonding with her baby? Work. There's so many really common influences that sort of help push us into these low and anxious cycles. And then we customize a 12-minute a day program for her, super manageable, based on techniques that we've tested, but also sourced from randomized controlled trials, things that have already been shown to be really, really effective for preventing and treating these disorders, and then refer her to additional support if she needs it.
Okay.
Yeah.
How effective is a 12 minutes a day? One of the themes I feel like I'm hearing throughout these interviews is sometimes the best innovation is a simple innovation, is a small step forward. So how powerful is that kind of program?
Well, our randomized controlled trial showed that 80% of moms who had symptoms of depression were below the referral threshold at the end of our program, which is extreme and a really high treatment effect, really, really strong program. So they are effective. And our goal was to just make it as easy as possible to do the program. So super simple, it's in English and Spanish, audio and text-based. We also have short videos and read-along text. The whole goal was accessibility, and basically, using a very good clinical product and leveraging the resource, research, but making it really, really kind of a wonderful experience for moms.
Is this company based in the U.S.?
Yes, yeah.
I just think about your history, your work history,
Yeah.
and I'm guessing that you have thoughts about the impact this could have globally.
Absolutely. I mean, so we are doing some work in the UK. We're interested in single payer markets because, the people who are most interested in working with us and our early customers are risk-bearing organizations,
Okay.
their health plans, their integrated delivery networks who see the rising costs of maternity care, see this huge gap in maternal mental health, and understand that we have to do something to address it. And most of the world is single payer systems.
How do you quantify the potential cost savings to a single payer system?
I mean, it's huge. I mean, maternal mental health conditions are the highest costing maternal morbidity in the U.S. So that $18 billion a year. So the opportunity is enormous, and 50% of maternal mental health conditions can be prevented. So you can do the math there. It's thousands and thousands of dollars per birth per year.
Do you feel like this is an area that's been neglected?
Very neglected. Yeah. I mean, through my own experience, but it's also just very, very obvious. We've never talked to a single partner or customer who's been like, oh yeah, we've got this handled.
Yeah.
No, we don't. But it's just getting started.
Okay.
Yeah.
So what's next for Canopie? What are you excited about?
Yeah, I'm really excited about this year. We spent the last year really refining our product, testing it, getting our research advisors on board. And this year is all about growth and scale and partnering. So we've got some great stuff happening with some health plans and health systems in Massachusetts and Florida and DC and North Carolina. And we're just excited about growing and learning and getting better. So
Who's an ideal partner for you?
It's really integrated delivery networks and health plans. We are, really, really interested in low-income moms in particular, Medicaid populations, because they tend to have more struggles and need, a higher need in those populations. So that's who we designed the product for. But if we address those barriers for that population, we can be relevant for any population.
Yeah. And thank you so much for taking the time with me today. I love the passion that you have for this. It's coming out of a personal experience, and yet you've also developed a really unique, skill set. And I know, you've got a great team as well. So we'll be watching what you do next.
Thank you, Logan. Thanks so much.